Breaking news out of St. Bernard Parish, where the Centers for Disease Control and Prevention confirmed the parish's water system tested positive for a rare amoeba.
State health officials stress the water is safe to drink. They say the tests came from 4 sites located in Violet and Araby. Just last week, health officials announced a 4-year-old child was visiting a St. Bernard Parish home back in July when the child came down with the amoeba and later died. Lee Isaacson joins us live from St. Bernard with the latest.
That's right, Kim. At those 4 locations, they tested hydrants and faucets that do connect directly to those parish systems. Now, just last week, when officials found out about the child's death, they began flushing this water system with chlorine because it's supposed to kill the amoeba. Initial tests did not pick up any traces of the amoeba, but since these additional tests were positive for it, the state says it will continue flushing the system and monitoring chlorine levels for weeks. Again, you cannot get the infection from drinking water, according to health officials. But we did speak with a doctor about the precautions you may want to take in this area.
It's a very, very, very low risk. If you want to protect yourself, keep your head above the level of the water, maybe pinch your nose if you're going to go underwater, or nose clips, all of which could prevent passage of water through the nose and potentially to infect the brain.
Here are some other precautions to consider. You may want to run baths and showers for 5 minutes before using them, and keep plastic or blow-up pools clean. And always use boiled and cooled distilled water for sinus rinses. Health officials say do not allow water up your nose or put your head under bath water. And don't allow children to play with hoses unsupervised. Again, officials say the infection from this amoeba is rare. There have been 3 deaths in Louisiana since 2011 with the amoeba tracing back to water. Back to you, Kim.
All right, Lee Isaacson reporting from St. Bernard. The CDC, meanwhile, has gathered plenty of information about this amoeba and how to prevent infection. You can find a link to the CDC's fact sheets in the links section of our website. Just head over to fox8live.com. Last week, after the death of a child who'd been visiting in St. Bernard, the CDC ran additional tests and confirmed the presence of the rare amoeba in 4 sites in Violet and Araby. Lee Isaacson joins us live with the new developments.
That's right. Those tests were from hydrants and faucets that were connected directly to the parish systems at those 4 locations. Now, last week, when officials found out about the child's death, they began flushing this water system here with chlorine because it's supposed to kill the amoeba. Initial tests did not pick up any traces of the amoeba, but since these additional tests were positive for it, the state says it will continue flushing the system and monitoring chlorine levels for weeks. Now, health officials say you cannot get the infection from drinking the water, but there are precautions you may want to take in this area, according to infectious disease specialist Dr. Fred Lopez.
Has to go through the nose. This is not an infection that's going to be acquired by drinking contaminated water. It's not going to be spread from person to person. This water has to go through the nose and make its way to the brain to cause this type of infection.
Now, as you heard, keeping the water from going up your nose is that main takeaway there. Since 2011, there have been 3 deaths in Louisiana linked to this amoeba that was traced back to water. At least one of those is believed to be from someone using a sinus rinse, something like a neti pot, that was also in St. Bernard Parish. Back to you.
All right, Lee Isaacson reporting from St. Bernard. Now, to learn more about the amoeba and the best ways to protect yourself and your family, you'll find a link to the CDC's information page on the brain-eating amoeba on our website, fox8live.com.
The first thing that hit me when it's a child, of course, you think about your child.
Yeah, it is kind of a concern for me. You know, 'cause I have lumens also, ma'am.
News quickly spread throughout St. Bernard Parish.
You don't think about those type of things until it happens.
A 4-year-old child from Mississippi was visiting a St. Bernard Parish home back in July when the child came down with a brain-eating amoeba and later died.
The child contracted it while playing for a very long period of time on a slip and slide in the front yard of the residence they were visiting.
It's usually found in water, and in this area of the country, particularly as it gets warmer or the levels of water get lower, we know that it's going to be, these organisms are going to be present in the water.
Dr. Fred Lopez from the LSU Health and Sciences Center says amoebas are found in fresh water, and he says the infection is very rare.
On average, 3 to 4 cases a year. But we know if we sample bodies of fresh water, and particularly in areas like Louisiana, we're going to find that organism present. But few people are developing these infections.
People cannot contract the infection by drinking the contaminated water.
This water has to go through the nose and make its way to the brain to cause this type of infection.
Once infected, there's a 99% mortality rate. Parish President Dave Peralta says federal, state, and local officials immediately began testing water inside of the Violet home where the child was visiting.
They did find an indication of the parasite in the tank of the toilet in the house and in one of the water lines.
While water samples taken from the home were all positive, Peralta says several tests were done on the water system here in St. Bernard Parish. He says those tests were all negative for the parasite.
We're continuing to do what's called a burn, which is we will introduce a little bit larger amount of chlorine to the water just as a precautionary measure. Again, nothing was found in the actual water supply.
Natasha Robin, Fox 8 News.
I was a little shocked because all of our tests of our sites continue to show the chlorine levels.
St. Bernard Parish President Dave Peralta says he was taken aback when test results from the Centers for Disease Control showed a rare brain-eating amoeba in the parish's water system.
If there is even the slightest risk, I have to treat it, and I have to treat the entire system too.
For 2 weeks now, the parish has been flushing its water system with extra chlorine to kill any potential parasites. The flushing started after a 4-year-old child visiting a Violet home back in July came down with the amoeba and later died. Immediately after the child's death, tests began. The parish tested 32 different sites, looking specifically at the chlorine levels. The CDC also began testing, but the CDC was looking specifically for the amoeba.
Not all the sites that they tested came out positive. It was just 4 sites. 2 at fire hydrants and 2 at these water bibs on people's homes.
The contaminated water was found in Violet and Araby, rattling the nerves of some residents.
She was worried about her little boy went under the water in the bathtub, and we don't know what's the answers.
Well, we're scared, naturally.
Out of an abundance of caution, School Superintendent Doris Voce decided to take action.
At our elementary and middle schools, we have disabled all of our water fountains, both inside the school and outside. And we did that only because while we know that the water is safe to drink and is not a problem, we had some concern that until this issue is totally settled, that a young child might drink from the water fountain and maybe the water would go up his nose.
Voce also closed the pool at Chalmette High.
We believe that the majority of the system is fine, but when you get a report like this, I have to take some type of action and I have to do some additional testing.
Natasha Robin, Fox 8 News.
To kill off amoebas and bacteria that could live in this water, there needs to be a detectable level of chlorine. That's where Jake Groby comes in. He and his staff at the St. Bernard Parish Public Works Department test 30 sites along the water system every month for chlorine levels. According to the state's Department of Health and Hospitals, or DHH, a chlorine reading of 0.5 milligrams per liter or higher will control the same amoeba that killed a 4-year-old boy in St. Bernard Parish this summer. Tests after his death showed some water in the parish was not chlorinated enough to kill the amoeba.
When we went and performed the amoeba testing in those areas, we found low to no detectable amounts of chlorine.
Documents Fox 8 obtained from the state and the parish show certain chlorine levels have been low for years.
What we're finding is that there are other areas in the system that we're having problems.
The state has general guidelines that recommend chlorine levels to be at least 1.5 milligrams per liter. In Araby and Violet, levels have often been below that recommendation since at least 2009. Take a look at the readings from this meter on Royal Street in Araby starting in 2009. For more than 2 years, chlorine levels were below 0.4, the minimum level the state says controls the amoeba. Then the parish stopped taking readings at that location. Over the past 5 years at certain locations throughout the parish, levels were even lower. In February and March of 2012, chlorine levels at the Wyclosky Fire Station dropped to 0.06 and 0.03. But keeping chlorine levels any higher is not a federal or state requirement.
They're saying it's recommended, it's not required, and I'm not splitting hairs. I'm just saying all these years we've worked with them, they have never complained to us that this wasn't good enough.
Though it's clear to the state now, levels have not been good enough in Arabi on streets such as Angela. This meter on Angela Street in Arabi has consistently shown relatively lower levels of chlorine than elsewhere in the parish since they started testing here in January of 2012. The state found traces of the amoeba and no levels of chlorine on this street just a few weeks ago. And in 2011, just a few blocks down the road, is where a 28-year-old died after using a neti pot with the tap water. One important distinction is that the reading that showed no chlorine was taken from an Angela Street home as opposed to directly tapping into the parish pipes. With low levels of chlorine in the area already, Jake Roby of the parish says the location of the test can make a big difference.
Based on the material that the pipe is, whether it be galvanized or plastic or transite or cast iron, the material wall coming in contact with the water will absorb a lot of the chlorine.
And it's much harder to keep water moving in areas like these. Nearly 200 homes used to pull water through the system here before Katrina. Now there's nearly no activity.
We knew from the outset, how do we keep the water fresh? How do we keep it moving? This is the answer.
In 2008, the parish installed 50 of these. They flush the system, directing water directly into the storm drain to keep the water flowing. But it's not enough to keep chlorine levels as high as the state suggests in certain areas like Arabi.
I can't tell you that I can maintain a 0.5 at that location. You know, it's just, I would be making it up, and I'm not going to do that.
Though the state might require it. Because St. Bernard Parish has had some Safe Drinking Water Act violations within the past 5 years, this violation of having areas with no chlorine in the water may mean it's time for the state to step in.
I believe looking back at the violation history, it looks like they may be at or near or past that trigger.
Jake Causey, the chief engineer at DHH, says he's working with the Environmental Protection Agency and the Center for Disease Control to decide what, if any, enforcement actions should be taken, such as administrative orders or fines to the parish. But more importantly, he says, the state and federal groups will focus on what changes need to be made to the water system so chlorine remains at a safe level throughout the parish. Lee Isaacson, Fox 8 News.
Well, a day after Fox 8 exposed low levels of chlorine showing up in water systems testing positive for brain-eating amoeba, Lee Isaacson joins the people working to test the water safety.
Tonight, her follow-up to this investigation in St. Bernard.
In the areas of the parish we saw today, chlorine levels are at the state's recommended level. We went with sanitarians from the State Health Department, the DHH, as they tested water at Andrew Jackson Middle School and Chalmette Elementary. With the ongoing chlorine flush, the state and parish are trying to get chlorine residuals throughout the parish to be 0.5 milligrams per liter. So that 0.5 number is a goal. At the elementary school today, readings showed that levels are at 0.8. At the middle school, 0.6. Jake Causey, the chief engineer at the DHH, says it's an improvement over when they found no trace of chlorine in certain areas a few weeks ago.
It's not necessarily concerning. It's not. We haven't achieved our goal yet. What would be concerning is it would really be areas where we did not detect, where we may not detect any chlorine. The fact that we are detecting free chlorine is actually very encouraging.
Now, again, that 0.5 level is usually just a recommended level, not required, even though the DHH says it's known to be the level to control the amoeba. In our Fox 8 investigation, we found that levels have dropped below 0.5 many times throughout the parish, including in the area in Arabi, where they found a trace of the amoeba in a home just a few weeks ago, and where a man in his late 20s died of the amoeba in 2011. Now, although most of the parish, it is important to remember, has levels well above the recommended level. They'll continue pumping chlorine throughout the system until everything reaches that 0.5 level. As for the long term, the state is in talks with the CDC and the EPA to see if higher levels of chlorine should be required instead of recommended. And I would guess that will be one of the questions raised here tonight at the Sewer and Water Committee meeting that is starting at 5:30. Back to you.
All right, actually more on that now, Lee. The parish leaders will work to answer questions that people have submitted about the water, holding that meeting. And what they've done is taken questions by email or fax that had to be in by 4:30 this afternoon. Those will be addressed in the meeting at 5:30 inside parish council chambers.
They're aiming for a 0.5. That's 0.5 milligrams per liter of residual chlorine in the water. And it's the level of chlorine the state says is known to control the amoeba that was found in the St. Bernard Parish water system and linked to the death of a 4-year-old this summer. 0.6. Sanitarians found that level of chlorine residuals at Andrew Jackson Middle School in Chalmette. It's the state's second week of monitoring system-wide chlorine levels in the parish, and the chief engineer for DHH says the tests have already shown improvements.
What would be concerning is it would really be areas where we did not detect, where we may not detect any chlorine. The fact that we are detecting free chlorine is actually very encouraging.
The state found no traces of chlorine in a house on Angela Street in Araby just a few weeks ago. It's the same street that has had relatively low levels of chlorine for years, according to parish and state data, and the same street where a 28-year-old man died of the amoeba after using a neti pot with the tap water in 2011. That 2 people have died in the parish in 2 years from the amoeba has many residents on edge and stirring with questions.
When did they know that the system was contaminated? What are they actually doing to flush the system out?
The public had a chance to get those questions answered at the parish's Water and Sewer Committee meeting.
I just asked about tubes in ears because that's all connected with the nasal. They said that it should be fine, but he doesn't really know.
Questions were submitted ahead of time to the committee and asked to the parish president, David Peralta, and the superintendent of quality control for the parish's Department of Public Works, Jake Groby.
There is no violation of chlorine standards in St. Bernard Parish.
Many scientific questions about the infection from the amoeba itself and questions about state and federal data collected after the 4-year-old boy died could not be answered.
It just seems like we've asked a lot of questions that were unable to be answered.
The meeting left a lot of questions on the table, including many questions from Councilman Ray Logo Jr., who is the head of the committee.
At least the questions out there, I'm looking for the administration to follow through with state authorities or federal authorities to get those questions answered.
Jake Groby did emphasize that the parish has always done the required amount of monitoring and kept to state and federal requirements for chlorine levels in the decades he's worked for the parish. He also called into question the location of where the state is performing its chlorine tests, for example, at fire hydrants.
As the water rushes through, it's going to suck soil and dirt in with the water. That doesn't make a difference if you're putting a fire out, but if you're taking a bacteriological quality sample, it makes a major difference.
Though those additional tests at sites like parish schools will continue to be done by the state as the parish flushes the system with chlorine, trying to bring the entire parish system up to that 0.5 level.
Infections are incredibly rare, but that didn't stop the worrying when Julie Vicknair inhaled water during a bath.
So I hope that nothing happens to me, and I hope that you protect the people of this parish. This should have never happened to anyone.
The St. Bernard Parish resident asked what so many people here want to know. Is the water safe? At a meeting in Chalmette Monday night, a panel of state and federal health officials says it's getting there.
It's going to take some time for it to move through the system. This is a big system, but we have been monitoring and we are seeing the results of this. We do see chlorine levels coming up, free chlorine levels coming up, moving out from the plant where it's being distributed and from a booster station located down the parish.
Parish and state officials developed a 3-part plan they say will kill the brain-eating amoeba found in the water system. The chlorine burn will continue, sending a stronger form of the chemical through the system until it reaches the very end of the water line. Those higher chlorine levels will be maintained for 60 days, and there will be a lot more testing.
The parish will be increasing its monitoring from 30 a month to 50 a month. And that's going to include 75 locations that they will be alternating as they do that monitoring.
More chlorine and more testing, what local, state, and federal officials believe will guarantee the water system is safe. In the meantime, people still need to take precautions.
If you live in St. Bernard Parish, it is important that you avoid getting water in your nose. However, the water is safe to drink.
State health officials call this an unprecedented response to the threat of the potentially deadly amoeba.
We're being very aggressive on this.
Out of the state's 1,400 water systems, 83 of them use the same chlorine and ammonia-based disinfectant that both St. Bernard and DeSoto use. The state's requiring all of those systems to raise chlorine levels to the known amount that kills amoeba. That's 0.5 milligrams per liter of residual chlorine. Up until now, they've only had to have a detectable trace of chlorine in most of the system. JT Lane with DHH says they're looking at changing that requirement. He reached us by phone as he was driving up to DeSoto Parish to do extra testing.
The EPA's rule is actually that they only require 95% of your samples each month to have a trace detectable amount. So what we're going to also examine is looking at we need to go up to 100 and strengthen that requirement.
Along with chlorine levels, the state is also looking into how the ammonia part of the treatment may actually play a role in the growth of pathogens.
Sometimes ammonia has byproducts that leaves behind nitrogen that can sometimes be a food for other pathogens or biological agents, but what we're doing is looking at that now.
Jake Groby, St. Bernard's water quality superintendent, says the parish started using the chlorine-ammonia combination back in 1989, as recommended by DHH and as part of an update to the U.S. EPA Safe Drinking Water Act. Jefferson Parish uses the ammonia-chlorine mix throughout its water systems, too. A water quality report from the parish shows that chlorine levels dropped to 0 at least one certain location in East Jefferson last year and to 0.1 in West Jefferson, though its averages are well above the now required levels to kill amoeba. Jefferson officials say they've always tested for biological activity if chlorine levels ever dropped below 0.5, and they will implement a flushing system if necessary to comply with the new state regulations. Other parish leaders say they're taking the same precautions.
In addition to the 55 required tests by the Department of Health and Hospitals, St. John has been doing additional testing along the distribution lines to make sure there's chlorine residual throughout the entire distribution system.
Lee Isaacson, Fox 8 News.